That was great, Chuck. Thank you very much. Is Ruth here? Oh, come on up. Chuck's one of those guys, just actually like everyone up here, really just goes about his business of being excellent and making it look easy. It's this team, I got to tell you, it's just such an honor and so much fun to be part of it, because you always know if something didn't happen, it wasn't because it couldn't have been done better. These guys are just fantastic. We're waiting for Dr. Steinman to come up. I see Heather Grillo and some of our nurses back here. I was just asking you guys to stand up. I think a lot of you people know them, but I'd just like to recognize them. They take care of you on the floor. In the thoracic intermediate care unit, I don't know if any of our OR nurses are here as well, but really they're the unsung heroes in this, because without them none of this happens. Mesothelioma, personally I can't fathom a more devastating diagnosis with which to be dealing with psychologically, and we recognize that, we deal with it, and we also recognize our inadequacies in doing that. And for that reason, we enlisted Dr. Ruth Steinman, psychiatrist, to help us with the program. Melissa refers to her, she says, called the angel. And Dr. Steinman really has helped so many of our patients, and we're very, very grateful to her for what she does and for being here. Ruth?
Great. Well, let's bring this down a big way. I am so happy to be here, and thank you for having me. My job is really to help people through the different stages that the emotional response to people who have a diagnosis of mesothelioma and their families. Very many people enter this crazy world not feeling like they're very brave, or that they can cope with this, or that really all of these steps would be possible, and they come out of it, they come out of active treatment saying, wow, I really did learn to cope with that, and I am feeling like I have so many more tools to face whatever is going to be next. Sometimes though, symptoms like anxiety or depression or fear overwhelm a certain stage, overwhelm a person during a certain stage, or a family member during a certain stage. And that's where I come in, to really help people step back and to start to reinforce some of the ways in which we can cope through things that we absolutely feel like there's no way that we could cope. So resilience gets a lot of, how resilient, my family member's not resilient enough, they're not coping enough. People worry about, how am I going to do this? Will I fall apart? How can I get from here to there? So resilience, I like to say what resilience isn't. Resilience isn't just being brave and buckling down and getting right through it. People who are resilient have an awful lot of trouble at different stages with anxiety. They feel that this is too stressful, overwhelmingly stressful, especially at pivotal moments like at the time of diagnosis, that they're overwhelmed. But that can be a very normal part of gearing up for the next step. Anxiety, sadness, depression, can be all very normal part of the cancer experience, and not something that we should be afraid of. Resilient people can be worriers. They can worry a lot about, will the cancer recur once active treatment is done? Will my energy ever return? I don't feel like I'm the same person. My relationship with God sometimes is changing and faltering, and I don't feel the same. Will I ever get that back? That was a big consolation in my life prior to this. Will my partner and I ever get back to normal? Will my friends ever understand me? Will I always feel like a foreigner in my peer group? So what makes someone more resilient than another? I'm often asking people when I first meet them, what have you coped with? What has life thrown you that you've had to really get through that you didn't maybe think that you could? And drawing on those coping strategies is often a very effective way of starting to come to get through some of this. Very many people, though, haven't really had to cope with very much, certainly not to this magnitude. And so I start to introduce ideas of how to really manage stress, how to use exercise and yoga and meditation, things that people have never really had any experience with, to try to manage the level of stress, especially through difficult periods. Some people are very good at asking for help. Many of us, though, are not able to really access the community, access our friends, access our family, and have people really listen. Help people learn to listen in an empathic way. So Dr. Freeberg mentioned glass half full and glass half empty. I have many people who come to me who are glass half empty people, or who one of the spouses is half empty, the other is half full. And that doesn't change through treatment. You know, that you can get through treatment and really have everything looking so great and the whole team is so happy for you, but you're still feeling like, oh, but you know, I've read about this and this is going to happen to me. That's not going to change. We're really not going to be able to change around our personality. But the ability to integrate some of the personality variables that come to people very easily, like hardiness and like an ability to reach out and a sense of prevailing over a struggle, we can help with that. We can actually introduce that. It's harder to do that, though, to help someone if they're already struggling in their life besides mesothelioma. So if someone comes to treatment with a poor marriage, a marriage that's really in trouble, a lot of family discord, financial issues, which affect all of us during the cancer experience, but other losses. If someone comes with pain that's uncontrolled, with insecurity about housing and food security, with problems with their medical insurance, and more we're going to be seeing that. We already do see that quite a bit. That is very hard to then cope. We really have to work as a team to stabilize some of these variables so that we can then draw on more coping capacity. So how do you do it? How do you manage uncertainty? Some of the strategies that I like to help people with is to really look at how someone is viewing cancer in their life. At the initial diagnosis and introduction of treatment, cancer fills your time, fills all your thinking. As you move through the treatment and as you move especially out of active treatment, if cancer is still monopolizing everything, then we really want to look at ways to compartmentalize that cancer. Cancer can't be all the time. So looking at parts of your life that you can really start to grow and start to rebuild, maybe not to the extent that you could before cancer, but that you can gain back a sense of identity and a sense of control over your life that doesn't involve cancer. It's a big one. Exercise, support groups, mindfulness meditation, which we do a lot at Penn. We provide a lot of instruction in that. Yoga, dietary modifications, all are things you do have control over. There's so much control that's taken away from you. But these are things you do have control and which really can help build a sense of resilience. Setting short-term goals, goals that are achievable and are going to bring some sense of pleasure. A small visit, a trip, something to look forward to really does help. Expressing emotion. Many of us can say one of our partners, I see this a lot where a spouse is really great at expressing themselves, maybe sometimes too great at expressing themselves, and then the other is very closed off. So the idea of we all have different ways of handling it, but learning to express emotion when we're not comfortable expressing it is very hard to do. But bottling it up often can lead to more difficulty. So that finding ways to say what you feel, even when those are very negative kinds of thoughts. So anger, very normal part of this process. Are you going to keep quiet and let it be bottled in, or are you going to find a safe place to release it, where someone actually can listen to you and can understand what that means? Are you going to turn to substances? Is that the way you've handled anxiety and difficult emotion in the past? Or are you going to start to practice relaxation or some other ways of handling stress that are more adaptive and are going to help you feel better rather than help you feel worse? Fear, how do you share with others, use distraction, join in on some kind of group that can help you manage the fear, or do you hide it and deny it and pretend that it's not there? Cognitive behavioral therapy has some techniques that are really helpful. Without having to go into a whole therapy, we can really learn from what they're teaching, which is to look at our negative, the way we view the world that can be quite negative, and trying to take those thoughts and those views of the world and turn them to be something that's more positive. So overgeneralization, life is hopeless, something very broad. To turn that around and say, well, at the moment, life isn't hopeless. Today isn't hopeless. This week isn't hopeless. I actually have something planned that's really actually very hopeful and brings me a lot of joy. I'm going to try to kind of narrow that in when I start to say, this is hopeless, the statistics aren't with me, those kinds of very broad statements. People who tend to magnify, this has destroyed my life. Has it destroyed all of your life, is the question to ask. Is there a life that's really precious to you, that has meaning, that's still there, that really hasn't been destroyed by cancer? All or nothing thinking. Nothing can be done to help me. This really is, I'm not going to be able to get through this. And thinking about it, well, I may not be able to be cured. Maybe that's true, maybe that's not true. But I have plans for the future. I have plans to add meaning to my life. I want my life. I do have a life. So planning for success, planning challenging and enjoyable activities into the week, trying to minimize cancer, the whole focus on cancer by scheduling appointments together. This is harder when you're in the midst of active treatment and you're here all the time. But after that, to really try to schedule follow-ups and scans so they don't monopolize all your time. Otherwise, it is pen, pen, pen. You're here all the time. Conserving energy to do things that can give you a sense of achievement and meaning. So that might mean that you don't actually do all the housework. You don't all do the grocery shopping and the cooking and still have time for that group that you're going to where you're going to play cards. You can't do it all. So if you can't do it all, what's really important to you to do today? Today I really want to get together and play cards. And I'm going to leave the dusting, whatever, to someone else. That's nodding, right? I don't have energy for everything. So what we know, talking about distress often helps to relieve it. That sometimes it's counterintuitive for people. A listener doesn't have to have the answers is really helpful for family. You don't have to make it better. That really just listening it can make such a difference. Talking about fears doesn't create them where they didn't exist before. And retelling the story helps to process and incorporate it. And if someone keeps on going over and over and over it, sometimes that's a necessary thing, but sometimes you can't hear it over and over as a family member, over and over. So help them find someone else to at least some of the time process it. So hope is the belief that a positive outcome lies ahead. It may look different at different times, and it can exist even when what we originally hoped for can't happen. We can hope for more time with family. We can hope for health and strength to attend some kind of great event. We can help for meaning, finding meaning, even if that meaning might be different from what we thought life was going to be bringing us. So you share your families with me, and I am so appreciative. So I put in a slide of mine. These are my kids. I also have some references. If you want some reading material or anything I can help you with in that regard, please let me know. Thank you.
Ruth, that was great. Thank you so much. And I speak for the whole program. We're just so grateful to you for all you do for our patients. I think what we'll do is we save the best for last. We're going to have Mr. and Mrs. Abel speak about the patient and family experience, and then we'll take our break. I think people can kind of formulate their questions, and then we'll have the whole panel come back up, and we can have our question and answer session. So Mr. Abel is known to many of you. I think Dr. Steinman made one mistake when she said you can't have energy for everything. I think Mr. Abel actually does, including reaching out to many patients and sort of helping them in a way that none of us can. And Mr. Abel, Mrs. Abel, we're just so grateful to you, and thank you for being up here.
Well, to follow everybody else, I won't have the clicker, so you won't have to worry about that. No slides. I was diagnosed November of 2009 with mesothelioma. I was told that I had mesothelioma. Didn't know what it was, just like it was explained. Nancy and I went home, looked up on the computer what it was. It's a kick in the gut when you find out what it is. Take it. Believe that you can get through it. Believe in the doctors that we have here. We are so fortunate in the Philadelphia area to have the doctors that we do have, the hospital that we have. I went through 6 rounds of chemotherapy. During the chemotherapy, I had 1.5 liters of fluid drained 5 times. So I've gone through all those processes. I had to wait 8 weeks for the chemo to get out of my system. I was introduced to Dr. Friedberg and the team, and Dr. Friedberg told me that I had to wait 8 weeks for the chemo to get out of my system. After the chemo was out of the system, he explained to me about the surgery. My first meeting was in April. Went home, wrote down all of my questions and notes. We went back and met with Dr. Friedberg again, and he spent 3 hours explaining everything to Nancy, my 2 daughters, and my sister came in. I cannot thank Dr. Friedberg enough for giving me the hope, first of all, and then the opportunity to go through the surgery. I had the injection of the HPPH June 10th of 2010, and I was operated on 2 days later. After the surgery, I was in the hospital for 6 days, and went home, did my recovery, walking around the hospital to get my exercise. With the HPPH, you have to watch the lighting. So I had a great big hat, sunglasses, white gloves, the sheet over my head, walking through the hallways. After the first couple of days, I told the nurses we have to speed this up. We have to get more rounds to go around the floor. I got home, did my exercising at home, went back, met with Dr. Friedberg. He said everything looks okay. I had an appointment then with Dr. Hahn, drove to see Dr. Hahn. By the time I got to see Dr. Hahn, Dr. Friedberg and Dr. Hahn spoke over the phone, and now I'm going to go through radiation. So I went through 30 days of radiation. Believe in what Dr. Friedberg, the team tell you. Go through it. They know what is best for the patient. I cannot be thankful enough to them. The support that you get from your family. Talk to them. You're going to have emotions. You're going to break down. It's all normal. The part that I get is giving back to some of the other patients is that I can talk to them, relate to them, tell them the different avenues that I went through One is when you're on these drugs and you're taking the medication, that you get constipated. It's normal. So get ahead of it. Take some type of medication to relax you, because you're straining. It's normal. So I tell everybody what I go through. I won't go through everything that I go through. If you want to know separately, I'll tell you. But it helps me to talk to other patients, to let them know it's a little different coming from a patient than it is from a doctor. Not saying that they don't explain everything, but somebody that has gone through the experience, it's a little different coming from them. And I cannot thank my wife, Nancy, like I said, my kids. You have to have something to release and talk to. And no matter how bad of a day you have, you look at your grandchildren, you see them, you smile, you forget about what is going through your mind. Just put that aside and live for what you have, and believe in the doctors that we have.
Okay.
Thank you.
Wow. Well, well, that's that's why we do what we do. I would say Mr. Abel is the primary reason, but probably arguably even more motivation than Mr. Abel and the patients that are here are the patients who aren't here. And that's what keeps us going. That's why we keep driving hard, and that's why we're in attack formation whenever we can. Why don't we take a 5-minute break now, and then we'll reconvene, and we can have our question and answer session to conclude the morning period. Thanks.